The heart is a vital organ that pumps blood throughout the body, ensuring that oxygen and nutrients reach every part of the body. It is surrounded by a protective sac called the pericardium, which acts as a cushion and barrier against infections. Sometimes this sac can become inflamed, leading to a condition known as pericarditis, which can affect the heart's function. Pericarditis is the inflammation of the pericardium, and it can be acute or chronic, depending on the duration and severity of the inflammation. This inflammation can cause chest pain and other symptoms, such as shortness of breath and a feeling of tightness in the chest. The pain is often sharp and stabbing, and it may worsen when breathing deeply or lying down, making it difficult to find relief. Pericarditis is usually caused by a viral infection, but it can also be triggered by other factors. Other causes include bacterial infections, autoimmune disorders, and certain medications, which can all lead to inflammation of the pericardium. Most cases of pericarditis are mild and resolve on their own with rest and simple pain relievers, allowing patients to recover fully. In some cases, however, pericarditis can lead to serious complications, such as pericardial effusion, which requires prompt medical attention to prevent further issues. Pericardial effusion is a condition in which fluid builds up between the pericardium and the heart. This fluid buildup can put pressure on the heart, making it difficult for the heart to pump blood effectively and efficiently. Pericardial effusions can range in severity from mild to life-threatening conditions. Small effusions may not cause any noticeable symptoms. However, large effusions can cause chest pain, shortness of breath, and lightheadedness in patients. Pericardial effusions can be caused by a variety of factors, including pericarditis, infections, heart surgery, and cancer. Treatment for pericardial effusion depends on the severity of the condition and the underlying cause. As we have seen, pericarditis is often caused by viral infections. These infections can lead to inflammation of the pericardium, the thin sac surrounding the heart. Bacterial infections, autoimmune diseases, and certain medications can also cause it. In some cases, the exact cause remains unknown, making diagnosis more challenging. Pericardial effusions can be a result of pericarditis, infections, heart surgery, and cancer. These effusions are an abnormal accumulation of fluid in the pericardial cavity. The most common symptom of pericarditis is sharp chest pain that may worsen with deep breathing or lying down. This pain is often described as stabbing or burning. Other symptoms may include fever, shortness of breath, and a dry cough. These symptoms can sometimes be mistaken for other respiratory conditions. For pericardial effusions, symptoms may include chest pain, shortness of breath, and lightheadedness. These symptoms can vary in intensity and may develop gradually or suddenly. In severe cases, it can lead to cardiac tamponade, a life-threatening condition where the heart cannot pump enough blood. Immediate medical intervention is crucial to prevent fatal outcomes. To diagnose pericarditis and pericardial effusions, doctors use various methods. These conditions can be complex, requiring a thorough and detailed approach. These include examining the patient's medical history, performing a physical exam, and listening for specific heart sounds that might indicate inflammation or fluid buildup. Additionally, doctors order tests like electrocardiograms, chest x-rays, and echocardiograms to get a clearer picture of the heart's condition and to identify any abnormalities. Treatment for pericarditis often involves rest and over-the-counter pain relievers like ibuprofen or naproxen. These medications help reduce inflammation and alleviate pain. In some cases, stronger pain medications may be necessary to manage more severe symptoms. Anti-inflammatory drugs may also be prescribed to further reduce inflammation and prevent recurrence. Treatment for pericardial effusion depends on its severity and cause. A tailored approach is essential for effective management. It may involve draining the excess fluid through a procedure called pericardiocentesis, which can provide immediate relief. Using medications to reduce inflammation is another key aspect of treatment, helping to prevent further complications. Addressing the underlying condition that caused the effusion is crucial for long-term recovery and preventing recurrence. The overall prognosis for these conditions is generally good with prompt diagnosis and appropriate treatment, leading to successful outcomes and improved quality of life for patients.